I want to follow up on you're talking about cancer patients, and I'm particularly thinking about immunocompromised patients
Yeah.
who don't have the option of wearing a mask themselves and going into a store with people not wearing it. So basically, how do you expect immunocompromised people to live a quote unquote normal life, like you're saying, when there's a heightened risk because people are now taking off their masks, and measures are being taken away?
Yeah. Well, as I said earlier, first of all, when they have to have access to medical services, then the mask will be mandatory for all the persons surrounding them in the clinic, specialized clinic for immunodepressed persons. And we are working with hospital managers and clinicians that are really worried about the fact that the mask could be released even in hospital. So this has been settled. It will stay in hospital and mostly in those units where the patients have to go and the patients that are immunocompromised. The other thing is that for patient immunocompromised, we are already moving up, and it has been said earlier, and they are all aware, most are aware of this, not only with a dose de rappel, a third dose, but a fourth one. So the primo vaccination is built with 3 vaccine doses instead of 2. So we higher their level, their personal level of immunity. The other thing is that we have a new medication like Paxlovid that could be used if those persons experiment a syndrome of COVID. So we can check it very, very rapidly if they are positive on a PCR test, and then move on with Paxlovid medication to lower their risk by more than 90% of getting a disease that will be tough and that will lead them to be hospitalized. So there are a lot of measures that could be adapted for those particular persons. But in fact, this will have to we will have globally to cope with the situation, because it's kind of impossible to ask for a whole population of 8.4, 8.5 million people to continue to wear masks to protect a part of them. And this is something that has to be done, sorry for my, we had to move like that in the recent measures because of the magnitude of the wave, to protect them and all of the citizens too, and essentially the healthcare system and normally the hospitals also. So we will have to just make sure that those people will continue to be protected, that the people will be sensitive to their situation, that they will take the good measures to protect themselves, that they will benefit from the vaccination and the 4th doses, and also to Paxlovid or the other medication that could be in place. And we do not have only Paxlovid, we have also other medication for them, especially if they have to experience a contagiosity with the virus. Sorry for the long answer, but